Welcome to this deep dive. We're going to be taking a look at meningoencephalitis of unknown origin,
MUO.
MUO, in dogs and cats.
Yeah.
We're going to be going through a scientific review article. We're going to be talking about kind of the history of MUO, the challenges of diagnosing it and treating it, and some of the exciting new potential therapeutic targets that are being looked into,
Right.
including the role of the blood-brain barrier and specific cytokines.
That's right.
So let's just jump right in. What is MUO?
MUO is an umbrella term for inflammatory non-infectious diseases of the central nervous system in dogs. And it can occur in cats too,
Right.
but it's much less frequent.
Right. And this paper really seems to push on the fact that there are a lot of different subtypes of MUO, and that maybe the way that we've traditionally classified them is a little bit
Too simplistic.
too simplistic. So we'll kind of dive into that.
Yeah.
This paper talks about how back in like the 1960s, GME was thought to be a tumor.
It was thought to be a tumor.
Can you talk a little bit about how our understanding has evolved?
Yeah. Well, I mean, for a long time, the cause of MUO has been a mystery.
Right.
And it's made treatment really difficult.
Right.
So, in the 60s, they thought it was a tumor, like you said.
Right.
And then we sort of figured out that it was more inflammatory, and people thought that it might be caused by a virus or another type of infection.
Right.
But that's never really been proven.
Right. Right. And so even today, like one of the biggest challenges in diagnosing MUO is that there's not really like one biomarker that we can look at.
Exactly.
So how do we go about diagnosing MUO today?
Well, we use a variety of different tools, including MRI, CSF analysis, and ruling out other causes like infections or neoplasia.
Right.
But ultimately, definitive diagnosis often requires a biopsy.
Right. And sometimes even the CSF findings can be normal.
Yeah, about 13% of dogs with MUO have normal CSF findings.
Which makes things even more.
Which makes things really tricky.
Really tricky.
Yeah.
So you have this challenge with the diagnosis. What about prognosis? Are there certain indicators that might give us a clue as to how a pet might do once they're diagnosed with MUO?
Well, there are a few things that we look at.
Yeah.
Certain clinical signs like reduced mentation and seizures have been linked to increased mortality risk.
Oh.
And interestingly, higher body weight and even advanced age are associated with a worse prognosis.
Interesting.
Yeah.
So even if you're an older dog who's been healthy up to this point,
Seems to be.
if you develop MUO, you might
you might not do as well.
not do as well.
Yeah. Interesting.
We also look at the findings on MRI. So things like loss of CSF signal and herniation are concerning.
Right.
And they're associated with an increased risk of mortality.
Right. So we talked about how diagnosis is difficult. We talked about some of the prognostic indicators. What about the debate surrounding like the root cause of MUO?
Yeah.
Is it autoimmune or is there some sort of infectious trigger? So in dogs, the evidence really points to an autoimmune basis,
Right.
particularly because we see these breed-specific predispositions. And,
Right.
we've been looking for an infectious trigger for a long time, and we haven't found one.
Right.
But in cats, there's been some recent research that's found that a virus called Restrela virus is actually responsible for a lot of cases of feline MUO.
Right. That were previously classified as staggering disease.
Exactly.
Yeah. So how do we make sense of this difference between dogs and cats?
Well, it's a good question.
Yeah.
It's probably multifactorial. Cats and dogs have different lifestyles.
Right.
Cats are more likely to be outdoors and exposed to rodents,
Right.
which carry the Restrela virus, whereas dogs are more often indoors.
Right.
And they might be more prone to developing autoimmune problems.
Right. Right. So it could be just kind of like differences in their environment and their lifestyle.
Yeah, and potentially genetic differences as well.
Right. Well, this paper definitely talks a lot about the genetics aspect of MUO, particularly in dogs.
Yeah.
They talk about how like NME in pugs has a heritability of like 0.67.
Right.
And that there's a link to a specific MHC2 haplotype.
Yeah.
Can you explain a little bit about MHC and how that might play a role in MUO?
Yeah, so MHC2 is a protein that's involved in the immune system.
Right.
And it helps to present antigens to immune cells.
Okay.
And certain MHC-CK haplotypes have been linked to an increased risk of autoimmune disease.
Right.
Not just in dogs, but also in humans.
Right. Right.
So this finding in pugs with NME is really similar to what we see in human autoimmune conditions like MS.
Right.
And it suggests that certain genetic variations might predispose individuals to developing an immune response against their own nervous system.
Right. So we've got genetics and environment potentially playing a role.
Right.
With this strong autoimmune component, at least in dogs.
Right.
The other thing that I thought was really interesting about this paper is that they talk a lot about the challenge of classifying the MUO subtypes, particularly between GME and NE.
Yeah.
Traditionally, we've relied on histopathology to differentiate them, but it seems like there might be some overlap.
Yeah, there's definitely some overlap. And it's possible that these subtypes aren't as distinct as we once thought.
Right. So rather than being like separate categories, they might be more of a spectrum.
Exactly. More of a spectrum.
Right. And even more confusingly, they even found a completely new variant of MUO characterized by CNS vasculitis.
Yeah, so it seems like our understanding of these subtypes is still evolving.
Okay.
So we're learning more all the time.
So MUO might be more of a spectrum than a set of distinct boxes.
Right.
But no matter what subtype we're talking about, the common thread is inflammation.
That's right.
So what do we know about the immune system's role in MUO?
Well, the immune system is definitely central to the development of MUO. And understanding the specific immune responses that are involved in different subtypes is crucial for developing targeted therapies.
Right. So how does the immune response differ between, say, GME and NE?
Well, GME is often characterized by a Th2 dominant immune response.
Correct.
Where Th2 cells, which are a type of helper T cell, play a prominent role in driving inflammation.
Okay.
And these Th2 cells produce a specific set of cytokines like interleukin-4, interleukin-17, and interleukin-21.
And what about NE?
NE, on the other hand, is driven primarily by a Th1 response, with Th1 cells being the main drivers of inflammation.
Okay.
And these cells produce a different set of cytokines, notably interferon gamma.
So why is this distinction between Th1 and Th2 dominance so important?
Well, it can have implications for treatment.
Right.
Because certain medications might be more effective at modulating Th1 responses, while others might target Th2 pathways.
So we really want to tailor treatment to that specific immune signature.
Exactly.
So this review article talks about some really exciting new research avenues that are focusing on specific cytokines as potential therapeutic targets.
Yeah.
One finding that I thought was particularly interesting is the significantly elevated levels of interleukin-31, or IL-31.
Right.
In the serum of dogs with MUO, particularly those with GME.
Yeah, that's a really interesting finding.
Yeah, and it's interesting because IL-31 has also been implicated in human autoimmune diseases like MS.
It has.
So it's not just like a marker of inflammation.
Yeah.
It might actually be contributing to the disease process.
That's what we think.
And there's actually a medication that targets IL-31 that's currently used in veterinary medicine for atopic dermatitis.
There is. It's called lokivetimab.
Right.
And it's a monoclonal antibody that specifically neutralizes IL-31.
Right.
And it's been shown to be safe and effective in dogs.
So there's a potential to really revolutionize treatment for MUO by having something that's a little bit more targeted than just throwing steroids at it.
Exactly. So that's a really exciting area of research.
The other really interesting topic that they talk about is the role of the blood-brain barrier, or the BDB.
Right.
And this is something that I think we all kind of learned about in vet school, but we don't always think about it clinically.
Yeah.
So can you kind of remind us, what is the blood-brain barrier and why is it important?
So the blood-brain barrier is a highly selective barrier that's formed by specialized cells that line the blood vessels in the brain.
Right.
And it acts as a gatekeeper, allowing essential nutrients to pass through while blocking toxins, pathogens, and even immune cells.
So it's really protecting the brain.
Exactly.
But this barrier can be breached.
It can, unfortunately.
Right.
And we know that the blood-brain barrier is compromised in a majority of dogs with MUO.
Okay.
And this allows for leakage of substances like albumin into the brain.
So albumin, that's the most abundant protein in our blood plasma. What happens when that starts leaking into the brain?
Well, albumin leakage can trigger a cascade of events that further disrupt the blood-brain barrier and contribute to neuroinflammation.
Oh, wow.
So basically it can activate astrocytes.
Right.
and microglia,
Right.
which then release inflammatory molecules and damage the blood-brain barrier.
It's like this.
And attract more immune cells.
Vicious cycle.
Yeah, it's a vicious cycle.
So is it the astrocyte damage that leads to the BBB breakdown, or is it the BBB breakdown that leads to the astrocyte damage?
That's a good question.
Yeah.
And it's something that we don't fully understand yet.
Right.
But there is some evidence that the blood-brain barrier disruption might even precede the onset of clinical signs.
Interesting.
So, for example, anti-GFAP antibodies have been detected in asymptomatic pugs.
Right.
That have a genetic predisposition to NME.
And just to remind our listeners, GFAP, that's the protein that's found in astrocytes.
Yeah.
So what does it mean that we're finding these antibodies in dogs that aren't showing any signs of disease?
Well, it suggests that the blood-brain barrier might already be compromised at that point, allowing these antibodies to enter the brain and potentially interact with astrocytes.
So the BBB might be getting disrupted before we even see any clinical signs.
That's what we think.
So this is all really fascinating.
It is.
You've got this interplay between the immune system,
right,
the BBB, and these very specialized brain cells that are all contributing to the MUO puzzle.
Exactly.
So what does all of this mean for treatment?
Well, this is where the review really advocates for a paradigm shift in our approach to MUO treatment. Currently, we rely heavily on immunosuppressive therapy, primarily long-term corticosteroids.
Right.
But this approach is often ineffective.
Right.
And it can be associated with a lot of side effects.
It's a double-edged sword because the steroids do help to reduce the inflammation. But they come with all these other consequences.
Exactly.
And oftentimes the disease comes back as soon as you try to wean the steroids.
Exactly.
So it's not a perfect solution.
Yeah. So what do they propose?
Well, they propose that we move towards a more personalized and targeted approach.
Okay.
And they introduce this concept of a polythetic approach to MUO.
Okay, polythetic.
Polythetic.
What does that mean?
So polythetic approach means that we consider a broader range of factors to create a comprehensive patient profile.
Okay.
Rather than just relying on the histopathology.
Okay, so what kinds of factors are we talking about?
We're talking about things like breed, age, specific clinical signs, biomarker levels, and blood-brain barrier integrity.
Wow, so we're really building like this detailed picture of the individual patient.
Yes.
And how does that translate into treatment?
Well, the idea is that by having this more detailed picture of the patient, we can then tailor the treatment to their specific needs.
Right. So, for example, a dog with a Th1-driven immune response might benefit from a medication that targets interferon gamma.
Right.
Whereas a dog with high IL-31 levels might respond better to lokivetmab.
Right. And if they have evidence of blood-brain barrier disruption, we might try to target therapies at restoring that BBB.
Exactly.
So it's moving beyond this traditional classification. And really embracing this holistic, personalized approach.
Exactly. I think that's really the future of MUO treatment.
Yeah. Well, I think this has been incredibly insightful.
Yeah.
I'm particularly intrigued by the potential of IL-31 as a therapeutic target.
It's really promising.
And this shift towards personalized treatment strategy.
Yeah, I agree.
It seems like
it's an exciting time to be in this field.
It's an exciting time to be in this field. It's giving us a lot of hope.
Absolutely.
For these patients. And one last thing before we move on, I wanted to touch on the fact that this review article actually acknowledges the use of AI tools like ChatGPT.
I know, I saw that.
And DeepL
in
its writing.
It's really interesting.
It's amazing how AI is becoming more and more integrated into scientific research.
Right. So it raises a lot of questions about the future of scientific communication.
Yeah.
But let's kind of bring it back to our listeners.
Yeah.
What are some of the key takeaways from our deep dive into MUO so far?
Well, I think the biggest takeaway is that MUO is probably more diverse than we previously thought.
Okay.
And that it might exist on a spectrum rather than as distinct subtypes.
Okay.
And there are some really promising new research avenues, particularly with IL-31 and the role of the BBB.
Right. And this potential shift towards a personalized polythetic approach to treatment could be a game changer.
Yeah, I agree.
For these patients.
Absolutely.
So it's really reassuring to know that research is advancing and that we're offering new hope for these dogs and cats that are affected by this really challenging disease.
Absolutely. This has been a real journey of discovery.
Yeah.
And it's just shedding light on all the complexities of MUO.
It is.
And highlighting the strides that are being made in unraveling all its mysteries.
Absolutely. It's a fascinating field.
It is a fascinating field.
Yeah.
So we're going to take a quick break, and then we'll come back and we'll talk about some more of the nuances of MUO.
Feels good.
So it's really inspiring to see all the researchers and the clinicians who are working so hard to improve the lives of these animals with MUO.
Absolutely it is. The progress we're seeing in understanding and treating this condition is really remarkable.
And it's interesting that they actually acknowledged AI in this paper.
I thought that was so fascinating.
Using things like ChatGPT and DeepL, right?
Yeah.
So really kind of integrating technology.
Wow.
So as we kind of wrap up this deep dive into MUO, what are some final thoughts that you would want to leave our listeners with?
Well, I think the key takeaway is that while MUO remains a challenging condition, there's definitely hope.
Yeah.
We're moving beyond the limitations of traditional approaches and embracing a more personalized and targeted approach to diagnosis and treatment.
And these advancements that we talked about with understanding the immune system, understanding the blood-brain barrier, the potential role of these cytokines like IL-31, it's giving us some really exciting new possibilities for more effective therapies and hopefully less burdensome therapies for these patients. So for pet owners who are facing this diagnosis, what advice would you give them?
I would say that it's important to remember that every case is unique.
Okay.
And I think it's really important to work closely with your veterinarian to ask questions. And to stay informed about the latest research developments. Because that can really empower you to make the best decisions for your pet.
Yeah. This deep dive has really been a journey of discovery.
It has.
And I think we've shed some light on the complexities of MUO and really highlighted the remarkable strides that are being made.
Absolutely.
In unraveling all of its mysteries.
It's a fascinating field.
It is a fascinating field.
And I think we're just scratching the surface.
And from Vet Neuro Jar,
keep those minds inspired, hearts light, and tails wagging.
Until next time. So it's really inspiring to see all the researchers and clinicians who are working so hard to improve the lives of these animals with MUO.
Absolutely. It is the progress we're seeing in understanding and treating this.
And these advancements that we talked about with understanding the immune system, understanding the blood-brain barrier, the potential role of these cytokines like IL-31, it's giving us some really exciting new possibilities for more effective therapies and hopefully less burdensome therapies for these patients.
Absolutely.
So for pet owners who are facing this diagnosis, what advice would you give them?
I would say that it's important to remember that every case is unique. And I think it's really important to work closely with your veterinarian to ask questions and to stay informed about the latest research developments, because that can really empower you to make the best decisions for your pet.
Yeah, this deep dive has really been a journey of discovery, and I think we've shed some light on the complexities of MUO and really highlighted the remarkable strides that are being made in unraveling all of its mysteries.
It has, for sure. Absolutely. It's a fascinating field.
It is a fascinating field.
And I think we're just scratching the surface.
And from Vet Neuro Jar,
keep those minds inspired, hearts light, and tails wagging.
Until next time.